Hello, everyone, and welcome to ADO's November webinar, which is on the topic of GERD awareness. GERD, or acid reflux, is thought to affect around 3 million Americans each year, but what causes it and how is it treated? Here to help us answer those questions is today's speaker, clinical assistant professor from Georgetown University and ADO's medical director. It's Dr. Howard Zahalsky. Welcome, Dr. Zahalsky, and thank you for joining us today.
Thank you very much, Tom. All right, so today we're going to talk about GERD, which officially stands for Gastroesophageal Reflux Disease. So we'll start by answering the big question, what is GERD? And GERD, or reflux, or heartburn, is when the acid from your stomach that your stomach naturally makes migrates out of the stomach, or refluxes, going the wrong direction up into your esophagus, which most of us will call our throats. One of the big problems with reflux, as you can see in this picture, is that because it causes chest pain, it often gets mistaken for a heart attack, or the reverse can also happen. A heart attack can be ignored because you think it's just reflux. Some of the classic signs that the problem is actually reflux and not a heart attack is that while you get some chest pain, it usually radiates to your back instead of to your arm or your jaw, which you often get with a heart attack. You often get it after eating, not with exertion or exercising, and it is much more likely to happen lying down. One big misconception with reflux that we will address as we go on is that when you are feeling the heartburn, if you only feel the heartburn a couple of times a week, you think you're only having reflux a couple of times a week. That's not at all true. By the time you are feeling heartburn, by the time you are feeling a burning sensation in your chest, the acid from your stomach has already eaten through several protective layers that the esophagus has to guard against the stomach acid, and you're down to the sensitive underbelly of the esophagus. You've already done a tremendous amount of damage and caused a lot of irritation to your esophagus by the time you are feeling classic heartburn. Because of this, reflux is considered actually a fairly serious disease. And if you have enough reflux for long enough, it can actually lead to some changes in your esophagus and even esophageal cancer in some people. So because of this, even just a quote-unquote little bit of reflux is oftentimes taken very seriously by primary care doctors and stomach doctors, gastroenterologists. So the next thing I want to do is explain how reflux happens in the first place, and we'll start to get a picture for that on the next slide. So most of us know that your stomach has acid. Stomach acid is normal. And in the top picture on this slide, you can see the normal stomach filled with this liquid acid. Why does your stomach have stomach acid? Well, the answer most people end up giving is that, well, of course, it's used to digest food. This is actually not the case. Stomach acid does very, very little to help with digestion. What it really does is sterilize the food. We eat a lot of junk. And by junk, I'm not talking about McDonald's and other fast food. We eat a lot of bacteria and viruses and parasites and other germs that are not healthy for us to get into our body. Mammals have developed stomach acid so that when all of this drops into the stomach acid sterilizes what we eat. That's why every time a waiter has a cold, we don't end up with a cold. That's why every time a piece of cookie falls on the floor and you stick it in your mouth because of the 5-second rule, we don't get sick every time. We have this stomach acid that helps to sterilize our food. But all of that stomach acid is supposed to stay in the stomach. And again, looking at the upper picture, you can see something called the lower esophageal sphincter, and then in parentheses it says closed. That's because that's a one-way door, or it's supposed to be, that lets the food drop from your esophagus or throat into your stomach, but isn't supposed to let the stomach acid go the other way. In the lower picture of the stomach, what you see is that some of that stomach acid is sloshing up into the esophagus because the lower esophageal sphincter is open. We're going to go into why the lower esophageal sphincter might be open in a couple of seconds, but For now, what we need to understand is that this acid sloshing up into the esophagus, which has a different lining than the stomach. The stomach has a special lining that's intended specifically to protect it from stomach acid. The esophagus, while it does have a protective layer, it's not nearly as protective as the lining of the stomach. When that acid gets on into the esophagus, it starts to eat its way through the lining and potentially get down to the more sensitive tissues below. So what keeps that lower esophageal sphincter closed? And the main answer is the diaphragm. You know, the diaphragm that you use to breathe, every time you take a deep breath in, there's this big flat muscle inside you that pulls downwards away from the lungs and helps to inflate your lungs. It's actually the biggest single muscle in the body. And the lower esophageal sphincter sits kind of right in the middle of it. It's encased in the diaphragm, which kind of squeezes the lower esophageal sphincter closed to keep it closed nice and tightly. In A, you can see kind of how it's supposed to be, with the diaphragm almost lined up perfectly with where the lower esophageal sphincter would be. You can see there's a little bit of the esophagus that's still below the lower esophageal sphincter in this picture. But that's an approximation of what it should be. In B, the stomach has kind of slid upwards a little bit. What that's done is it pulls the lower esophageal sphincter out of position. Now the lower esophageal sphincter is above the level of the diaphragm, and the diaphragm can't squeeze as well. This just can naturally happen, and in fact, by the time you're about 50 years old, a majority of people, their stomach has slid around a little bit and the lower esophageal sphincter has become somewhat displaced, usually in an upward direction. By the pictures in C and D, you can see that even part of the stomach has slid past the diaphragm. The diaphragm is that purple horizontal line that you see in each one of the pictures. And now the acid, at least some of it, is being made north or above the diaphragm, making it very easy to slide past a now unprotected, unbuttressed lower esophageal sphincter into your esophagus. In C and D, those sections of the stomach that are now past the diaphragm are what's known as hiatal hernias. You've probably heard that term, hiatal hernia. Again, this is a very common condition. North of 33% of 50-year-olds have some level of hiatal hernia because it is very common for the stomach as you age to slide up past the diaphragm, weakening the tightness of the lower esophageal sphincter. But it's not merely stomach sliding that contributes to reflux. Even if you have a fully tight lower esophageal sphincter, there's a variety of things that can contribute to reflux, or if you do have a misplaced lower esophageal sphincter, certainly make it worse. And let's go on to the next slide. Spicy food. Here's a jar of Tabasco sauce. Spicy food is a big cause of reflux. Now, there's a lot of people out there who really like their Mexican food or their hot Indian food, or even put hot sauce on just about everything they eat. Well, when this hot sauce or the hot spices get into your stomach, they cause a surge in acid production because your body detects those chemicals and says, don't particularly care for those in my stomach, and releases a lot of extra acid. More acid, obviously more acid around to slosh in the wrong direction up into your esophagus. And if you already have a weakened lower esophageal sphincter because of a sliding stomach or hiatal hernia, this is going to make your reflux significantly worse. Unfortunately for me, the next thing on the list is chocolate, and the same thing is true for peppermint. These are two tasty treats that actually have chemicals in them that weaken the tightness of your lower esophageal sphincter. Eating these doesn't actually increase stomach acid, but it just makes you a lot more likely to have reflux symptoms. So for somebody who does have a hiatal hernia or even just reflux not associated with a hiatal hernia, limiting your peppermint and chocolate consumption can sometimes make a big difference in your symptoms. Here's one of the biggest issues: eating late at night, raiding the refrigerator in the middle of the night. You see, if you think back to some of the earlier slides we talked about, the acid's supposed to stay there in the bottom of your stomach, while the esophagus, as you can think about as you're probably sitting watching this presentation, goes upward from the stomach to your mouth. Well, gravity helps keep that acid in your stomach. When you lie down at night, you get rid of that added benefit of gravity, and the acid kind of sloshes along the back wall of the stomach, or if you're someone who likes to sleep on their front, the front wall of your stomach, and it creeps up much more towards that lower esophageal sphincter, which now is on the same gravitational level as the stomach acid. So it becomes very important to minimize the amount of stomach acid that's in your stomach when you go to bed. Well, stomach acid increases when you eat, especially if you eat something spicy. Remember, it's the job of stomach acid to sterilize everything that you eat. So your body naturally increases stomach acid production every time it detects food in it. So if you eat right before bed, or even worse, wake up in the middle of the night to go get a snack, you're going to dramatically increase the amount of acid in your stomach right when gravity is unable to help you keep that acid in your stomach and away from your esophagus. And one of the biggest causes of reflux, alcohol. Alcohol is a muscle relaxant. You may be familiar with this. People have a lot more trouble walking around when they've had a lot of alcohol. It also deadens nerves that help to keep that lower esophageal sphincter tightly contracted. You may think of alcohol as being something to loosen people up, and it sure does. And it loosens up that lower esophageal sphincter. And by doing so, it makes it a lot easier for stomach acid to come up through the lower esophageal sphincter and into your esophagus and cause heartburn. So if you're someone who suffers from a lot of heartburn, limit your alcohol consumption. That can oftentimes go a big way to controlling your symptoms. But let's say you've done everything right. You're trying not to eat late at night. You're not eating foods that are too spicy. You're avoiding chocolate and peppermint and alcohol. What happens if you still have reflux? This is a triangle. It's actually a bed wedge. Again, the main time when people with bad reflux experience their worst symptoms is when they're lying down in bed. That lack of gravity pulling the acid away from your esophagus causes a lot of symptoms. So by merely raising the head of your bed a little bit, in this case by using a bed wedge, you sleep at a little bit of an angle, and it helps to pull that stomach acid away from your lower esophageal sphincter. If you don't have a bed wedge and don't want to order one on Amazon, you can always get a couple of bricks and just put one under each front corner of your bed frame. And that will just raise up the head of your bed a couple of inches, and even that little bit can oftentimes be enough to keep your reflux overnight under control. But it doesn't work. You tried the bed wedge, you ate right, and you're still getting reflux. Where do we go from here? And on the next slide, we'll see some of the most common ways to treat reflux. And the first thing everyone reaches for is the over-the-counter antacid. Antacids come in chalky pills like the one here. They also come in liquid form, that chalky liquid that comes under a variety of trade names that I'm sure many people are familiar with. What these medicines do is they neutralize the acid that is currently in your stomach. Since the heartburn that you are feeling is because of acid that is currently in your stomach and esophagus directly burning its way through your esophagus, they can be very helpful and they can work very quickly, but they only get rid of the acid that is presently there. As soon as they're washed through your stomach, since your stomach is constantly making more stomach acid, especially if you've eaten recently, these symptoms are going to come right back. And people who use these antacids oftentimes find themselves using many, many doses over the course of a day because they don't permanently solve anything. The next step is some of the other over-the-counter medications that have names like Zantac and Pepsid and Acid. What those medications do is they temporarily disable the pumps that are making the glands in your stomach that are making the stomach acid. They can be very helpful and tend to last because they're actually disabling the pumps and not just treating the stomach acid that's there right now. They can be very helpful, and they can last for 12 hours or so in some cases. The problem is that they don't actually do anything to neutralize the acid that's currently in your stomach. So if you wait until you're actually having heartburn to take, let's say, a Zantac, it can be hours until you actually have relief of your symptoms. That's why there are some combinations now that combine something like Zantac with something like the tablets you see here to both neutralize the acid that's there now as well as prevent new acid from being formed in the upcoming hours. The main prescription medications, although some of these have now gone over the counter, that have been used to treat reflux are what's called the proton pump inhibitors. Remember, I use the word pump to refer to those glands that produce acid in your stomach. The glands are actually called proton pumps, and it's those protons that actually are acidic in your body. The proton pump inhibitors permanently disable the acid-producing pumps in your body. The problem is it takes them a little while to work, and in the case of some, it can even take a couple of days to work. And like the Zantac, Pepsid-type medications, they do nothing to treat the acid that's actively in your stomach at the time you take them. So it is important, if you want these medicines to work, to take them on a regular basis before you ever get symptoms, if you know that you're prone to reflux. We generally recommend taking a proton pump inhibitor like the omeprazole you see on your screen every day if you are having 3 or more episodes of heartburn a week. Remember, if you're having 3 or more episodes of heartburn a week, it means you're having a lot more reflux than just 3 episodes a week. It means you're having so much reflux that you've eaten through the protective layers of your esophagus and are now actually having painful reflux at least 3 times a week. So if you are having that much reflux, you get into a higher category of risk for such things as esophageal cancer. And in an effort to protect against esophageal cancer, the current recommendations are you take a medicine like this, which can last for up to 24 hours, one every single day. Now, there has been a lot of attention recently drawn to the proton pump inhibitors because there has been a question of whether this class of medication may be associated with other medical problems. One thing that proton pump inhibitors has been associated with is increased likelihood of pneumonia. That's actually true. Why would it be true? Well, remember, the stomach's job is to neutralize and sterilize a lot of bacteria that you might swallow. Let's just say that you have reflux, that you have a weak lower esophageal sphincter. By taking these medicines, you neutralize or get rid of the acid in the stomach juices, but that doesn't get rid of all the stomach juices. It just gets rid of the acidity in it. So what can happen is if you're prone to reflux, sometimes, let's say when you sleep, some of that gastric juice still comes up into your throat. It just doesn't burn your throat, so you don't feel it or notice it, and it drips down into your lungs. And if that fluid has some bacteria in it that wasn't killed off by the acid, you can increase your chance of pneumonia. This generally is only true for elderly and otherwise ill people. Most young, healthy people, people in their 30s, 40s, and 50s who have reflux but are generally in fairly good health, don't usually need to worry about an increased chance of pneumonia. And compared to the increased risk of esophageal cancer, it's still considered worthwhile if you have aggressive heartburn to take the omeprazole any day, every day. The other issue that's been raised with these medications is kidney problems. Most doctors that I know don't actually believe that these medications are in fact associated with significant kidney problems. there are a lot of diseases, for instance, diabetes, that increase both your risk of reflux because diabetes slows your stomach and makes it more likely that the acid goes the wrong way, and with kidney problems. And so far, these studies have not adequately controlled for other diseases that may be causing both an increase in reflux and an increase in kidney problems. Another example is high blood pressure. Chronic high blood pressure can lead to kidney problems, and chronic high blood pressure, certain medications that we give for it also increase your likelihood of having significant reflux. So until there are more studies done to better identify whether these medicines are actually the causative agents, or whether people with diseases that cause kidney problems are just more likely to get reflux, I wouldn't worry too much about this class of medicine, the proton pump inhibitor, causing significant kidney problems. So let's say that you have bad reflux and you've been trying to take your proton pump inhibitor on a regular basis, but you're either scared of the medicine because of what you've read about, or even sometimes even these medicines are not strong enough to keep your reflux under control. What do you do then? And what you see here is something called a Nissen Fundoplication. It's an endoscopic surgery, which means they just make a few small cuts and they don't have to actually open you up, where they wrap part of the stomach itself around the lower esophageal sphincter, essentially taking the place of the diaphragm and tightening that sphincter, that valve, to make it harder for the stomach acid to reflux the wrong way. This can be a tremendously effective surgery, especially if you have a hiatal hernia, of dramatically to completely getting rid of any reflux or heartburn symptoms. But it's still surgery, and like any surgery, it carries risks of injuring the stomach, and very, very rarely they can tie the stomach too tightly and actually make it difficult to swallow. But the vast majority of people with this surgery have very successful outcomes. So, in summary, if you have reflux, if you have painful heartburn, especially heartburn that is happening 3 or more times a week, it's important to make sure that you're on the right medication. It's important to watch your diet, your alcohol intake, and try and make sure that at night you're sleeping slightly with a head-elevated bed through either something under the headboard or a pillow wedge in the bed. If none of those work, seeing a specialist in reflux can be very helpful, because in extreme cases, a Nissen Fundoplication can be very helpful. On the next slide, I'm going to tell you how Activ Doctors Online can help you if you're a chronic reflux heartburn sufferer. So, Activ Doctors Online has 3 interesting platforms that can help you if you're someone who suffers from bad reflux. First, we have our personal health records. Unlike the EMR that may come free with your doctor's EMR, your doctor's EMR may have a PHR for you, but they're usually not smart PHRs like Activ Doctors Online's personal health record. Our PHR can be set up to send alerts so that if your kidney function is worsening, you'll get notified. You could track your reflux and send those reports to your doctor so that they can help treat you properly if your reflux seems to be accelerating. With our e-consultation feature, if your doctor is a member of Activ Doctors Online's group of doctors, it enables you to talk with your doctor virtually. So if your reflux may be increasing or you want to report how you're responding to one of the medications, sometimes those can be very quick visits that don't require you actually going all the way to the doctor, and they can talk with you online through our platform. And finally, with our second medical opinions, we can put you in touch virtually with one of our specialists from around the country or even around the world who can review your online personal health record and possibly recommend whether more aggressive therapy such as a Nissen Fundoplication might be appropriate for you. To learn more about all of the solutions that Activ Doctors Online has and how you can potentially participate in them, I'm going to turn it back over to Tom, who will tell you a little bit more about how to get started.
Well, thank you, Dr. Zahalsky, for another excellent presentation. Here at Activ Doctors, our vision is to reinvent healthcare by providing user-friendly mobile health solutions that allow people all over the world to live safer, healthier, and more productive lives. We strive to educate, engage, and empower our members to take control of their health destiny to save time, money, and even lives. We hope you enjoyed today's presentation, and we invite you to start a free 30-day trial over at activdoctorsonline.com and by clicking Get Started. For more information, to schedule a demo, or if you have any questions about our service, please feel free to contact ADO using the information on screen. Thank you for watching, and we look forward to seeing you next month for another informative health webinar.